What organ of the lymphatic system is the site of T-cell maturation? A. The thymus. B. The spleen. C. The cisterna chyli. D. The lymph nodes. The answer is A. The thymus. T-cell maturation occurs in the thymus, a small organ located in the upper part of the mediastinum, between the heart and the sternum. Mature T cells then may either circulate in the lymph or blood or reside in lymph nodes. The spleen is not a site of T-cell maturation, though it does have other important immune functions, such as the production of antibodies and the removal of antibody-coated pathogens. The cisterna chyli is a part of the lymphatic system that is involved in lipodigestion. Digestive fat is absorbed through what specialized lymphatic vessels of the small intestine? A. Villi. B. The cisterna chyli. C. Lacteals. D. Microvilli. The answer is C. Lacteals. Dietary fat is absorbed via lacteals, small lymph vessels contained within the body of the intestinal villi. Microvilli, tiny projections covering the surface of the villi, help with the absorption of minerals, vitamins, and other micronutrients. The cisterna chyli is a dilated pouch at the lower end of the thoracic duct that serves as a collection point for fatty chyle from the intestinal lacteals. Which of the following is not a function of the lymphatic system? A. Absorption and transportation of dietary fats. B. Lymphocyte transport and activation. C. Secondary gas exchange. D. Draining of interstitial fluid from tissues. The answer is C. Secondary gas exchange. The lymphatic system has several roles in the body, including drainage of interstitial fluid from tissues, transportation and activation of lymphocytes, and absorption and transportation of dietary fats. Red blood cells, however, are unable to enter lymph vessels, and so the lymphatic system does not participate in any type of gas exchange. When drawing blood, the client tells the nurse that she is a universal recipient. The nurse knows this to mean that the patient has which type of blood? A. O negative. B. AB negative. C. A positive. D. AB positive. The answer is D. AB positive. AB positive is a universal recipient, meaning a patient with AB positive type blood can receive a blood transfusion using any type of blood. Every Hem group in hemoglobin encloses an atom of what element? A. Magnesium. B. Chromium. C. Copper. D. Iron. The answer is D. Iron. Each Hem group in hemoglobin encloses a single iron atom in the center of a protoporphyrin, a tetrapyrrole composed of 4 pyrrolyl rings linked together by 4 methyl groups, 2 vinyl groups, a methane bridge, and 2 propanoic acid side chains. What is the average lifespan of an erythrocyte? A. 4 months. B. 6 weeks. C. 6 months. D. 3 months. The answer is A. 4 months. The average lifespan of a red blood cell is 4 months, after which it is phagocytosed by macrophages, the spleen, liver, or lymph nodes. White blood cells, on the other hand, live for only about 3-4 days. What hormone stimulates the casting of new red blood cells? A. Luteinizing hormone. B. Vasopressin. C. Erythropoietin. D. Thyroxine. The answer is C. Erythropoietin. The casting of new red blood cells is stimulated by the hormone erythropoietin, EPO, released from the kidneys. Recall that all blood cells are made in the bone marrow. This hormone may increase as much as 1,000-fold in times of oxidative stress. Thyroxine is T4, the most biologically active form of thyroid hormone. Vasopressin, or antidiuretic hormone, is part of the body's fluid balance system. Luteinizing hormone is a hormone of the reproductive tract. In females it triggers ovulation, while in males it stimulates Leydig cells to produce testosterone. Where is erythropoietin produced? A. Peritubular interstitial cells of the kidney. B. Lactotroph cells in the pituitary gland. C. Zona fasciculata cells of the adrenal glands. D. Supraoptic and paraventricular cells of the hypothalamus. The answer is A. Peritubular interstitial cells of the kidney. Erythropoietin is produced by the peritubular interstitial cells of the kidney. These cells are very sensitive to tissue oxygen pressure. When oxygen demand increases, erythropoietin is released, stimulating the casting, hematopoiesis, of new red blood cells in bone marrow. Supraoptic and paraventricular cells of the hypothalamus are the site of vasopressin, antidiuretic hormone, production. Lactotroph cells in the pituitary gland are responsible for the production of prolactin. Zona fasciculata cells of the adrenal glands produce cortisol. Neutrophils make up what percent of white blood cells in the blood? A. 20 to 35%. B. 55 to 70%. C. 70 to 90%. D. 2 to 6%. The answer is B. 55 to 70%. Neutrophils are the most common type of white blood cell, making up 55 to 70% of the total white blood cell population in the average blood sample. Eosinophils make up what percent of the average white blood cell count? A. 5 to 15%. B. 1 to 3%. C. Less than 1%. D. 20 to 40%. The answer is B. 1 to 3%. Eosinophils are the leukocytes that are largely responsible for response to parasitic infections and allergies. They make up 1 to 3% of the average white blood cell count. They form the second smallest population of white blood cells, after basophils, which normally make up less than 1% of white blood cells in whole blood. Monocytes make up what percent of the average white blood cell count? A. Less than 1%. B. 2 to 10%. C. 26 to 33%. D. 55 to 70%. The answer is B. 2 to 10%. Monocytes, the largest of all the leukocytes, make up just 2 to 10% of the average white blood cell count. These white blood cells will mature into macrophages to phagocytose foreign matter. Monocytes make up what percent of the average white blood cell count? A. Less than 1%. B. 2 to 10%. C. 26 to 33%. D. 55 to 70%. The answer is B. 2 to 10%. Monocytes, the largest of all the leukocytes, make up just 2 to 10% of the average white blood cell count. These white blood cells will mature into macrophages to phagocytose foreign matter. What is the role of platelets in the blood? A. Gas exchange. B. Cytotoxicity. C. Clotting. D. Histamine release. The answer is C. Clotting. Platelets are small cell fragments that play an important role in hemostasis, or clot formation. Once activated, platelets release clotting factors that recruit more platelets till a clot is formed and bleeding stops. The process by which white blood cells move into and out of blood vessels is dash. A. Phagocytosis. B. Diapedesis. C. Granulocytosis. D. Endocytosis. The answer is B. Diapedesis. Diapedesis, also known as leukocyte extravasation, is the process by which white blood cells move into and out of blood vessels. This process includes 4 stages: chemotraction, rolling adhesion, tight adhesion, and endothelial transmigration. This process is integral in the delivery of white blood cells to sites of infection and in their return into the bloodstream to mobilize and facilitate the excretion of waste. All of the following white blood cells are granulocytes except dash. A. Monocytes. B. Basophils. C. Neutrophils. D. Eosinophils. The answer is A. Monocytes. Neutrophils, eosinophils, and basophils are all granulocytes, meaning they contain visible granules within their cytoplasms. These granules contain acids and antimicrobial enzymes, and are released at the site of infection. Monocytes and lymphocytes are granulocytes, meaning they do not contain granules in their cytoplasm but rather destroy foreign proteins by other means, such as phagocytosis and cytotoxicity. Platelets are derived from what parent cell? A. Plasma cells. B. Megakaryocytes. C. Erythrocytes. D. Progranulocytes. The answer is B. Megakaryocytes. Platelets are derived from megakaryocytes, cells produced in bone marrow, kidney, liver, and spleen, with large, lobed nuclei. Platelets are formed within the cell and then released into plasma. Erythrocytes, mature red blood cells, plasma cells, a type of B cell, and progranulocytes, precursors to neutrophils, basophils, and eosinophils, take no part in the creation of platelets, which are fragments of cells, not whole cells. What is the average amount of blood in the adult body? A. 3.5 to 5.5 liters. B. 6 to 7.5 liters. C. 4.5 to 6 liters. D. 7.5 to 9 liters. The answer is C. 4.5 to 6 liters. The average adult body contains 4.5 to 6 liters of blood, depending on size and gender. Blood volume, BV, can be calculated by the following formula, given the hematocrit, HC, and plasma volume, PV. BV equals PV divided by 1 minus HC. The most common free plasma proteins include all of the following except dash. A. Globulin. B. Major histocompatibility complex, MHC. C. Albumin. D. Fibrinogen. The answer is B. Major histocompatibility complex, MHC. The three main types of proteins in the blood are albumin, globulin, and fibrinogen. Major histocompatibility complex is not a free plasma protein, but rather a class of proteins found on the surface of all nucleated cells, MHC class I, and on the surface of certain immune cells known as antigen-presenting cells, MHC class II. They play an important part in immune function by displaying foreign antigens for communication between leukocytes. Lymphocytes, natural killer cells, T helper cells, and B cells, make up what percentage of white blood cells? A. 55 to 70%. B. 1 to 3%. C. 26 to 33%. D. 5 to 15%. The answer is C. 26 to 33%. Lymphocytes are the second most common class of white blood cells, making up 26 to 33% of white blood cells. Which of the following blood cells is anucleate, lacking a nucleus? A. Natural killer cells. B. Dendritic cells. C. Megakaryocytes. D. Erythrocytes. The answer is D. Erythrocytes. The only anucleate blood cells are erythrocytes, or red blood cells. These cells are created with nuclei, but each daughter cell will then lose its nucleus in order to create more surface area for hemoglobin to bind oxygen and for easier passage through narrow capillaries. The nurse cares for a patient hospitalized for 5 days with pneumonia. He is about to be discharged and the nurse is providing discharge instructions to the patient and the family. Which statement made by the patient's family should most concern the nurse? A. He can stop taking the antibiotics when the symptoms are gone. B. He still has to use the incentive spirometer to keep his airways clear and open. C. He can eat normally but we have to make sure he has a nutritious diet. D. He can start doing his chores when he feels better, but shouldn't overexert himself and should rest a lot. E. He should stay away from other sick people because his immune system is still weak. The answer is A. He can stop taking the antibiotics when the symptoms are gone. When a patient has an infection and is prescribed antibiotics, the patient should always take the full course of the medication and never discontinue the medication. It is easy for patients to believe they can stop taking the medication when the symptoms are resolved, but the nurse needs to educate the patient to continue the full regimen. The rest of the statements are accurate. The patient must get adequate rest, eat well, use the incentive spirometer, and stay away from others who are sick until he is well. A 2 plus radial pulse is considered to be dash. A. A normal pulse. B. A bounding pulse. C. An absent pulse. D. A weak pulse. The answer is A. A normal pulse. The following scale applies to the amplitude of a pulse when palpated at the radial artery. 3 plus is an increased or bounding pulse, 2 plus is a normal pulse, 1 plus is a weak pulse, 0 is an absent pulse. Which of the following locations is most appropriate for assessing the pulse of an infant? A. Carotid artery. B. Brachial artery. C. Radial artery. D. Popliteal artery. The answer is B. Brachial artery. The most appropriate location for assessing the pulse of an infant is the brachial artery, which travels from the axilla down the ventral surface of the upper arm to the cubital fossa. The popliteal and radial pulses are difficult to palpate on an infant due to their size, and the carotid artery can be difficult to palpate due to an infant's shorter, thicker neck. Which of the following is a normal adult respiratory rate? A. 11 breaths per minute. B. 9 breaths per minute. C. 16 breaths per minute. D. 22 breaths per minute. The answer is C. 16 breaths per minute. Normal adult respiratory rate is 12 to 20 breaths per minute. A respiratory rate below 12 is defined as bradypnea, while a respiratory rate above 20 is considered tachypnea. What is a normal respiratory rate for an infant under 1 year of age? A. 30 to 60 breaths per minute. B. 20 to 30 breaths per minute. C. 10 to 20 breaths per minute. D. 60 to 90 breaths per minute. The answer is A. 30 to 60 breaths per minute. Infants have the highest respiratory rate of any age group. A normal infant respiratory rate is 30 to 60 breaths per minute. How might an overlarge cuff affect your blood pressure reading? A. The reading would be artificially low. B. There would be no significant effect. C. The reading may be unstable. D. The reading would be artificially high. The answer is A. The reading would be artificially low. An overlarge blood pressure cuff will often result in a blood pressure reading that is artificially low. It is important that the nurse chooses the appropriate blood pressure cuff size for each individual patient. While assessing a patient's blood pressure, what part of the stethoscope should be placed against the patient's antecubital fossa, the bell, or the diaphragm? A. The diaphragm. B. The diaphragm should be used first, then the bell. C. The bell. D. The bell should be used first, then the diaphragm. The answer is A. The diaphragm. When taking a patient's blood pressure, the diaphragm alone should be used to listen at the antecubital fossa. The bell, used for low-pitched sounds, would not give the examiner accurate enough information to assess systolic or diastolic pressure. Which of the following would be considered a normal adult blood pressure? A. 124/84 millimeters of mercury. B. 88/56 millimeters of mercury. C. 110/72 millimeters of mercury. D. 132/88 millimeters of mercury. The answer is C. 110/72 millimeters of mercury. Normal adult blood pressure is anywhere from 90 to 120 millimeters of mercury systolic over 60 to 80 millimeters of mercury diastolic. 120 to 140 millimeters of mercury over 80 to 90 millimeters of mercury would be considered prehypertension, while anything over that would be considered either stage I or stage 2 hypertension. What is a normal respiratory rate for a child aged 1 to 6 years old? A. 34 to 44 breaths per minute. B. 12 to 24 breaths per minute. C. 36 to 54 breaths per minute. D. 24 to 34 breaths per minute. The answer is D. 24 to 34 breaths per minute. A normal respiratory rate in a child aged 1 to 6 years is 24 to 34 breaths per minute. This is significantly higher than an adult normal respiratory rate, which is 12 to 20 breaths per minute. What is a normal heart rate for an infant under 1 year old in beats per minute, BPM? A. 160 to 240 BPM. B. 100 to 160 BPM. C. 60 to 100 BPM. D. 30 to 60 BPM. The answer is B. 100 to 160 BPM. Infants have the highest heart rate of any age group. Normal heart rate for an infant under 1 year of age is 100 to 160 BPM. What is a normal heart rate for a school-age child, 6 to 12 years of age, in beats per minute, BPM? A. 100 to 140 BPM. B. 50 to 70 BPM. C. 70 to 120 BPM. D. 120 to 160 BPM. The answer is C. 70 to 120 BPM. Normal heart rate for a child aged 6 to 12 is 70 to 120 BPM. This is moderately higher than normal heart rate for an adult, which is 60 to 100 BPM. What is the correct way to determine proper blood pressure cuff size? A. The inflatable bladder should cover approximately 50% of the circumference of the forearm while its width should cover approximately 20%. B. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. C. The inflatable bladder should cover approximately 40% of the circumference of the forearm while its width should cover approximately 80%. D. The vinyl covering should be able to wrap at least twice around the forearm. The answer is B. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. Proper cuff size is very important for accurate blood pressure assessment. The correct way to determine proper blood pressure cuff size is to wrap the cuff around the arm, then note the area covered by the inflatable bladder. The inflatable bladder should cover approximately 80% of the circumference of the forearm while its width should cover approximately 40%. A stethoscope has two components to the chest piece. These are called the dash and the dash. A. Cone. Diaphragm. B. Bell. Diaphragm. C. Bell. Disc. D. Cone. Disc. The answer is B. Bell. Diaphragm. The chest piece of the stethoscope is made up of two components designed for auscultation, the bell and the diaphragm. The bell is dome-shaped and used for auscultation of low-pitched sounds, while the diaphragm is used to auscultate high-pitched sounds. A nurse takes a patient's blood pressure and records it at 146/92 millimeters of mercury. This is the patient's first visit to the clinic and they have no past medical records available. Would this patient be diagnosed with hypertension? A. Yes, this is stage I hypertension. B. No, there is not enough information. C. Yes, this is malignant hypertension. D. No, this is within the normal range. The answer is B. No, there is not enough information. A patient with a one-time high blood pressure reading cannot be diagnosed as hypertensive. A diagnosis of hypertension requires at least 3 measurements of blood pressure over 140/90 millimeters of mercury on at least 2 separate visits to healthcare provider. A patient with a blood pressure reading of 168/102 millimeters of mercury on 3 or more occasions would be diagnosed with what stage of hypertension? A. Stage 3 hypertension. B. Stage I hypertension. C. Stage 2 hypertension. D. Pre-hypertension. The answer is C. Stage 2 hypertension. Stage 2 hypertension is defined as a blood pressure equal to or greater than 160 millimeters of mercury systolic over 100 millimeters of mercury diastolic, taken at 3 different times on at least 2 separate occasions. Stage I hypertension is systolic blood pressure of 140 to 160 millimeters of mercury or diastolic blood pressure of 90 to 100 millimeters of mercury, while prehypertension is defined as a systolic blood pressure of 120 to 140 millimeters of mercury or diastolic blood pressure of 80 to 90 millimeters of mercury. Which of the following is not a normal part of taking a patient's vitals? A. Overall visual appearance. B. Pulse. C. Temperature. D. All of these are part of taking a patient's vitals. The answer is D. All of these are part of taking a patient's vitals. While most examiners remember to take the pulse, temperature, and blood pressure while assessing their patient's vitals, overall visual appearance is also an important part of an individual's vitals. Does the patient appear ill? Anxious? Are there any noticeable issues with hygiene or bizarre dress or movements? Are there any signs of pallor, jaundice, or cyanosis? All of these observations can be quickly noted in a patient's chart when taking vitals. The pulse of your patient is 120 beats per minute. What is the appropriate term for this finding? A. Normal heart rate. B. Tachycardia. C. Bradycardia. D. Aortic stenosis. E. Asystole. The answer is B. Tachycardia. Tachycardia is the term used to describe a faster than normal heart rate. A heart rate of more than 100 beats per minute is considered tachycardic. Bradycardia is used to describe a slower than normal heart rate. Less than 60 beats per minute is considered bradycardia. The physician on call pages you to ask if the patient you are taking care of is febrile. Which of the following vital signs would you find in an febrile patient? A. Blood pressure of 105/89 millimeters of mercury. B. Temperature of 97.9 degrees Fahrenheit. C. Respiratory rate greater than 25 breaths per minute. D. Heart rate of 105 beats per minute. E. Temperature of 103.2 degrees Fahrenheit. The answer is B. Temperature of 97.9 degree Fahrenheit. A febrile is a term used to describe a patient who does not have a fever. Clinically, a fever is defined as a temperature greater than 100.4 degree Fahrenheit. Blood pressure, heart rate, and respiratory rate do not tell you if the patient has a fever. A 39-year-old man presents to the ER with weakness, confusion, and vertigo. His heart rate is 91 and bounding, blood pressure is 132/85 millimeters of mercury, temperature is 99.0 F, and blood glucose is 49 milligrams per deciliter. He is non-diabetic, he is not on any medication, and he denies recreational drug use. Which of the following is the most likely cause of his symptoms? A. Hypertension. B. Hypoglycemia. C. Panic attack. D. Infection. The answer is B. Hypoglycemia. The most likely cause of his symptoms is hypoglycemia, which is defined as a blood glucose below 50 mg per deciliter in a non-diabetic patient. The symptoms of hypoglycemia include altered consciousness, tremors, weakness, vertigo, headaches, heart palpitations, and a bounding pulse. A temperature of 99.0 degree Fahrenheit is not considered abnormal as it may reflect a normal variation in body temperature. His blood pressure is slightly elevated, but it is unclear whether this is typical for him or whether this represents a significant change from his normal blood pressure. Regardless, it would not likely be sufficiently elevated to cause his symptoms. It is also possible he may be experiencing a panic attack, but in the presence of his depressed blood sugar, and absence of signs of anxiety, hypoglycemia is the most likely cause of his symptoms. Abdominal rigidity and decreased bowel sounds would raise your suspicions of what condition? A. Cystitis. B. Cholecystitis. C. Peritonitis. D. Ulcerative colitis. The answer is C. Peritonitis. Abdominal rigidity and decreased bowel sounds are classic signs of peritonitis. In addition, the patient will often want to lie very still, as any motion often increases pain. Cystitis, ulcerative colitis, and cholecystitis all may cause significant abdominal tenderness but would not generally result in rigidity or decreased bowel sounds. Why are blind finger sweeps not recommended in infants with foreign objects in their oral cavities or airways? A. They may injure the oral cavity. B. They may force the object in deeper. C. They may trigger a gasping reflex. D. They may trigger a vomiting reflex. The answer is B. They may force the object in deeper. Blind finger sweeps are not recommended in an infant with airway restriction due to a foreign object because they may inadvertently force the object deeper into the airway. A finger sweep should only be used if the object can be visualized. Injury to the oral cavity would not be a primary concern in the case of airway restriction, and a finger sweep would not be expected to trigger either gasping or vomiting in an infant. All of the following are forms of shock except dash. A. Cardiogenic. B. Hypovolemic. C. Anaphylactic. D. All of these are forms of shock. The answer is D. All of these are forms of shock. The four main categories of shock are as follows: cardiogenic, sudden inability of the heart to pump sufficient blood to the body, most commonly due to acute myocardial infarction. Hypovolemic, due to loss of fluids or hemorrhage. Septic, also known as entotoxic shock. Dangerously low blood pressure as the result of systemic inflammatory response to infection. Anaphylactic, systemic inflammatory response to an allergen. What is the normal range for hemoglobin levels in an adult female? A. 12.1 to 15.1 gram per deciliter. B. 4.0 to 9.0 gram per deciliter. C. 14.1 to 21.1 gram per deciliter. D. 8.1 to 13.1 gram per deciliter. The answer is A. 12.1 to 15.1 gram per deciliter. The normal range for hemoglobin in an adult female is 12.1 to 15.1 gram per deciliter. Hemoglobin levels above that range may be indicative of chronic low blood oxygen, while lower levels of hemoglobin are seen in anemia. What is the normal range for hemoglobin levels in an adult male? A. 10.7 to 15.7 gram per deciliter. B. 13.6 to 7.7 gram per deciliter. C. 16.6 to 22.7 gram per deciliter. D. 18.7 to 23.7 gram per deciliter. The answer is B. 13.6 to 17.7 gram per deciliter. The normal range for hemoglobin levels in an adult male is 13.6 to 17.7 gram per deciliter. Hemoglobin levels above that range may be indicative of chronic low blood oxygen, while lower levels of hemoglobin are seen in anemia. What should you expect to hear when percussing the seventh intercostal space along the right midclavicular line? A. Dullness. B. Hyperresonance. C. Tympani. D. Resonance. The answer is A. Dullness. When percussing the seventh intercostal space along the right midclavicular line, you should expect to hear a dull note, as this is directly over the solid mass of the liver. The border of the liver can be found by percussing in a descending line along the intercostal spaces of the right midclavicular line, starting at the clavicle. The superior border of the liver can be measured at the point where percussion transforms from resonant or hyperresonant, indicating the air-filled lung, to dull, indicating the solid mass of the liver. On palpating the abdominal aorta, the diameter of the aorta is measured at 3 cm. This indicates an abdominal aorta that is dash. A. Narrow or constricted. B. Normal size. C. Significantly enlarged and at risk for rupture. D. Slightly enlarged. The answer is B. Normal size. A healthy and normal abdominal aorta will measure between 2.5 to 3 cm in diameter. An abdominal aorta over 3 cm and under 5 cm in diameter is considered to be enlarged, and surgery to prevent abdominal aortic aneurysm is generally performed on abdominal aortas that surpass 5 cm in diameter in females or 5.5 cm in diameter in males. A patient reports to urgent care for colicky pain in the upper right quadrant that they rate as a 7 out of 10. The night before they ate a fatty meal with 2 glasses of wine. Which of the following tests would help you assess for cholecystitis? A. McBurney's point. B. Soa's sign. C. Murphy's sign. D. Rovsing's sign. The answer is A. Murphy's sign. A positive Murphy's sign is an indication of cholecystitis, or gallbladder inflammation. Testing for Murphy's sign is performed during an abdominal exam by asking the patient to breathe out slowly while the fingers of the examiner are slid under the right costal margin and held in place with firm pressure. The patient is then asked to inhale, which forces the abdominal contents upward. Murphy's sign is considered positive if the patient winces or flinches when breathing in, due to pain when the inflamed gallbladder comes in contact with the examiner's fingertips. Rovsing's sign, Soa's sign, and McBurney's point are all tests for appendicitis. When testing for the strength of the left biceps brachii muscle, a patient is found to be able to move freely against gravity, but is unable to flex against very gentle resistance by the examiner. What grade of muscle strength should their bicep be assigned? A. 3 of 5. B. 2 of 5. C. 4 of 5. D. 1 of 5. The answer is A. 3 of 5. In this case, the patient is able to move their biceps brachii against gravity, but they are unable to move against gentle resistance by the examiner. This means the muscle strength should be graded at 3 of 5. The muscle strength grade is as follows: 0 of 5, no contraction 1 of 5, muscle contraction, but no movement 2 of 5, movement with gravity, but not against gravity 3 of 5, movement against gravity, but not against resistance 4 of 5, movement against mild resistance by the examiner 5 of 5, normal muscle strength. What is the reference range for normal potassium levels? A. 3.5 to 5.0 milliequivalents per liter. B. 3.5 to 4.8 milliequivalents per liter. C. 3.2 to 5.0 milliequivalents per liter. D. 3.2 to 4.8 milliequivalents per liter. The answer is A. 3.5 to 5.0 milliequivalents per liter. The range for normal potassium levels in blood is 3.5 to 5.0 milliequivalents per liter. Anything above that, hyperkalemia, or below that range, hypokalemia, is considered abnormal. What is the reference range for normal sodium levels? A. 138 to 148 milliequivalents per liter. B. 130 to 140 milliequivalents per liter. C. 135 to 145 milliequivalents per liter. D. 132 to 142 milliequivalents per liter. The answer is C. 135 to 145 milliequivalents per liter. Normal levels for sodium are between 135 to 145 milliequivalents per liter. Anything below 135 milliequivalents per liter, hyponatremia, or above 145 milliequivalents per liter, hypernatremia. This is considered abnormal and should be evaluated further.